Welcome to LATAM MedTech Insights. Today we are tackling a critical question for software as a medical device, or SaMD, manufacturers eyeing the Brazilian market. Is your ISO 13485 certificate enough to get your product registered? The short answer is no. While ISO 13485 is the foundation of a quality management system, it is not, by itself, sufficient for SaMD registration with ANVISA, Brazil's health regulatory agency. Brazil requires proof of compliance with its own Brazilian Good Manufacturing Practices, known as BGMP. For higher-risk SaMD, specifically Class 3 and 4 devices, obtaining a BGMP certificate from ANVISA is a mandatory step. This is where many companies face significant delays. A direct BGMP inspection from ANVISA can have a waiting list of 2 years or even longer, effectively freezing your market entry plans. This is where the Medical Device Single Audit Program, or MDSAP, becomes a strategic tool. ANVISA is a full participant in the MDSAP program. This means that ANVISA will accept a valid MDSAP audit report as a substitute for their own BGMP inspection. Submitting an MDSAP audit report allows you to bypass the long queue for a direct inspection, reducing the BGMP certification timeline from years to just a matter of months. This is arguably the single most effective accelerator for market access in Brazil. For example, consider a company with a revolutionary AI-powered diagnostic software. They have ISO 13485 certification and are ready to expand. Without MDSAP, they apply for BGMP certification and are told to wait for an inspection slot in 24 months. A competitor, also with a great product and ISO 13485, but who also invested in MDSAP certification, submits their application at the same time. The competitor uses their MDSAP audit report and receives their BGMP certificate within 6 to 8 months. They enter the Brazilian market a year and a half ahead, capturing market share and establishing critical relationships with hospitals. Even for lower-risk Class 1 and 2 SaMD, which follow a simpler notification pathway called notification, you are not exempt from quality system requirements. While you may not need a pre-market BGMP certificate, you must have a compliant QMS in place. ANVISA can and does conduct post-market inspections, and failure to demonstrate compliance can result in product removal and fines. Therefore, the strategy is clear. ISO 13485 is your internal standard for quality. BGMP is the Brazilian requirement, and MDSAP is your strategic key to efficiently demonstrating BGMP compliance for high-risk devices. To navigate these complex regulatory pathways and accelerate your entry into Latin American markets, you need local expertise. For help with your regulatory strategy in Brazil and beyond, email us at info@pureglobal.com or visit us at https://pureglobal.com.